Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Ebola. Introduction.
Ebola is a viral infection that causes fever. It can lead to severe bleeding known as hemorrhagic fever. Ebola leads to bleeding in the body and organ failure. People can become infected with Ebola if they come into contact with the body fluids of an infected human or animal. Treatment for Ebola may include giving the patient medication, fluids, and oxygen. This program explains Ebola. It discusses the symptoms and causes of the illness, as well as treatment options.
Ebola. Ebola is a type of fever caused by a rare virus. The fever causes bleeding, known as hemorrhagic fever. Hemorrhagic fever prevents the blood from clotting normally. It can also damage the walls of blood vessels, making them leak. This can lead to severe bleeding in the body and organ failure. Ebola infections are common in tropical areas of Africa. People who live in or travel to tropical areas have a higher risk of getting Ebola. Ebola can infect humans and mammals, such as monkeys, bats, and pigs. Ebola can spread from person to person through contact with body fluids or contaminated needles. Humans can also become infected when they come into contact with infected animals. An Ebola outbreak is when a region has many Ebola infections at once. The first outbreaks of Ebola happened in Africa. The largest outbreak of Ebola in history started in 2014 in West Africa. The 2014 Ebola outbreaks in Africa have spread mostly because people have cared for Ebola patients without proper protection. Healthcare providers, family members, and friends of infected patients are at the highest risk of getting infected. They may come into contact with the blood or body fluids of sick patients, such as vomit or diarrhea. People who have hunted wild animals or come into contact with bats have also become infected with Ebola in West Africa. People infected with Ebola react differently to the virus. The reaction depends on their immune system. Ebola often causes death in people who become infected. Those who recover from Ebola infection develop antibodies that last for at least 10 years. Symptoms. Symptoms of Ebola can happen suddenly. They may start within 2 to 21 days after a person comes into contact with the virus. An infected person usually isn't contagious until they develop symptoms of the virus. Early symptoms of Ebola are similar to those of the flu and other diseases. Symptoms of Ebola usually include a fever that is higher than 101.5 degrees Fahrenheit, 38.6 degrees Celsius, chills, headache, joint and muscle pain, weakness. Ebola can also cause diarrhea and vomiting, loss of appetite, stomach pain, weight loss. Ebola can also cause a cough, a skin rash, chest pain. Ebola can also cause bruising and bleeding that happens inside and outside of the body. Bleeding may happen from the eyes, nose, ears, and rectum. Complications of Ebola include bleeding and organ failure. Other complications include coma, delirium, jaundice, seizures, shock. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Ebola is a virus. It usually infects people and animals. People can get Ebola if they come into direct contact with the body fluids of an infected human or animal. Body fluids that can spread the virus include blood, saliva, semen, Vaginal fluids. Ebola can also be spread through breast milk, feces or stool, mucus, sweat, vomit. Kissing, oral sex, vaginal sex, and anal sex can transmit the Ebola virus from an infected person to a healthy person. The virus can also infect a person through an open cut, wound, or abrasion in their skin. Ebola is not spread through the air or by water. Mosquitoes and other insects cannot transmit the virus. Only mammals can become infected and spread it. Butchering or eating an animal that is infected with Ebola can cause infection. Coming into contact with the feces, urine, or other body fluids of an infected animal can also spread the virus. Doing scientific research on mammals infected with Ebola also increases the risk of infection. Healthcare providers who do not use protective gear, such as surgical masks and gloves, while treating patients with Ebola may get infected. Reusing needles and syringes for different patients can spread the Ebola virus. Family members who care for sick relatives or who prepare dead relatives to be buried are at risk of infection. Sharing utensils, towels, or drug needles with an infected person could lead to infection. Diagnosis. The early symptoms of Ebola are similar to the symptoms of many conditions, such as the flu. You should not be worried about getting Ebola unless you think you have come into contact with body fluids from an infected person or animal. Blood tests are usually used to diagnose the Ebola virus. But if a person has not told their healthcare provider why they may be at high risk for Ebola, the early symptoms may be mistaken for another disease. If you have symptoms of a fever and you know you are at risk of Ebola infection, tell your healthcare provider before you visit the healthcare facility so that they can protect other people while you receive treatment. Tell your healthcare provider if you have recently been to an area where there has been a recent outbreak of Ebola. Hunted wild mammals in Africa. Used wild mammals from Africa or the Philippines for research. Treatment. A medication called Imazeb is approved by the FDA to treat Ebola. It greatly increases a patient's chance of survival. Treatment for Ebola may also include giving the patient extra fluids and oxygen. During treatment, healthcare providers will try to keep the patient's blood pressure at a steady level. Replace lost blood. Treat other infections or complications that may happen. Recovery from Ebola is slow. It can take months for a person to regain their strength and become healthy. During recovery, patients may experience changes in their senses, eye inflammation, genital inflammation. Patients may also experience hair loss, headaches, liver inflammation. Prevention. There is a vaccine available to prevent Ebola. It is taken as a single dose. Other ways to protect yourself from being infected with Ebola include avoiding areas where there are known outbreaks of the illness and following healthy hygiene habits. If you have to visit a place where there is an Ebola outbreak, wearing gloves and masks when in public may help prevent infection. Avoid contact with people who are known to be infected. Infected people should be isolated from others. If you are in a place where there are known cases of Ebola, do not kiss or have sex with anyone who may be infected. Once someone recovers from Ebola, they can no longer spread the virus through most body fluids. But Ebola virus has been found in semen for up to 3 months. People who recover from Ebola should not have sex for 3 months after recovery. Ebola has also been found in the breast milk of mothers who have survived the virus and no longer have symptoms. Breastfeeding mothers should not breastfeed their babies for at least 1 month after they recover. Avoid all contact with wild animals in places where Ebola is common. Do not hunt, eat, or buy wild animals, especially mammals. To help prevent infections, follow these healthy hygiene habits. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Do not share utensils or towels. Avoid touching your eyes, nose, or mouth. Cover your wounds with bandages. Coming into contact with the body of a person who died of Ebola can lead to infection. Only trained specialists should handle or bury the remains of Ebola victims. The remains should be buried as soon as possible after the person has died. For healthcare providers. Healthcare providers who may be exposed to patients with Ebola should wear protective clothing. This includes masks, gloves, gowns, and eye protection. Healthcare providers should sterilize all medical tools and dispose of all needles once they have been used. Needles should not be reused for different patients. Healthcare providers should clean surfaces with a hospital-grade disinfectant, such as bleach. Healthcare providers should isolate patients with Ebola. If a patient dies from Ebola, healthcare providers should avoid direct contact with the dead body. Only trained specialists should handle or bury the remains of Ebola victims. Remains should be buried as soon as possible after the person has died. Healthcare providers should tell health officials right away if they come into direct contact with the blood or body fluids of an infected patient.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Ebola is a viral infection. It causes severe bleeding and is known as a hemorrhagic fever. Ebola leads to bleeding in the body and organ failure. Symptoms of Ebola may start within 2 to 21 days after a person comes into contact with the virus. An infected person usually isn't contagious until they develop symptoms of the virus. Symptoms of Ebola usually include a fever that is higher than 101.5 degrees Fahrenheit, 38.6 degrees Celsius, chills, headache, joint and muscle pain, weakness. Ebola can also cause diarrhea and vomiting, loss of appetite, stomach pain, weight loss. People can become infected with Ebola if they come into contact with the body fluids of an infected person. Body fluids that can spread the virus include blood, saliva, semen, or vaginal fluids. Ebola virus can spread to humans through the blood or waste products of an infected animal. Ebola virus has been found in mammals, including monkeys, chimps, and bats in Africa. Ebola is often deadly without treatment. A medication called Imazeb is approved by the FDA to treat Ebola. It greatly increases a patient's chance of survival. Treatment for Ebola may also include giving fluids and oxygen. Healthcare providers will try to keep the patient's blood pressure at a steady level. Replace lost blood. Treat other infections or complications that may happen. Call your healthcare provider right away if you think that you have been exposed to Ebola. Tell your healthcare provider about your symptoms before you visit the healthcare facility. This can help your healthcare providers protect other people. If you are in an area where there are known cases of Ebola, avoid contact with people who are infected and do not go hunting for wild animals. Practice good hygiene habits. Wash your hands often, cover your wounds with bandages, and avoid touching your eyes and mouth. Thank you for using Explain.